patient know what breast size implants to get? I know that there's so much talk about that, and it's such a hard thing for a woman to choose. Do you have bras in your office that they can try on, or what do you recommend?
Yeah, that requires a lot of work coming to the appropriate size for a particular patient. You know, both the doctor and the patient need to be heavily involved in that decision. You know, I always start out by asking patients what kind of size and look they're going for in general. That gives me an idea what their goals are. We look at pictures together, get a good sense of what their goals and expectations are. In terms of, you know, from my point of view as a surgeon, technically, the most important thing that I look at getting right is the width of the implant. I want the base, the footprint of the implant to fit that person's chest naturally and give them a nice natural result. If the implant's too narrow or too wide, it gives a suboptimal result. So we've got to get that set first. And then there can be a lot of variation to the size of the implants. I actually have a couple here. These are two implants. Hopefully you can sort of see these, but they're actually the same size implants in terms of volume. One's just a lot narrower in terms of the width, and one is a lot wider. So once we set the width that we want, we have some flexibility with the patients in terms of coming up with the size that's going to make them the happiest. And as you mentioned, we do have sizing kits in the office, so patients can basically slip on what's essentially like a sports bra that has little inserts in it. They can slip the different size implants in and out and get a good sense for what they're gonna look like after surgery.
You know, with that said, you're talking about the base of the implant. Now, does that parameter determine how much cleavage a woman will receive during her augmentation?
There's a lot that goes into that. You know, part of it is what a woman starts with. But the base diameter is, you know, as I mentioned, it's the most important footprint to set to give the right shape to the base of the breast. But actually projection of the implant, we talk about high profile or mid-range profile or low profile implants. Again, this kind of shows that difference. These are the same volume implants, but you can see this one is much flatter and wider. And this one is much narrower, but it sticks out more. And so that's going to give a bustier look when it's sitting against the chest than one that's wide and flat.